Okay, let's call the meeting to order. Roll call, Matt and Paul had said they weren't going to be here. I don't know about Mark at this point yet. Could I get a motion to approve the agenda as submitted?
So moved.
Okay, Tim, is there a second?
I second.
Doak, all in favor say aye.
Aye.
Opposed? Hearing none, agenda is approved. The approval of the minutes from our October meeting. Yes, is there a motion to approve it? Linda? Okay, Joanne is the second. Any discussions about it? If not, all in favor say aye.
Aye.
Opposed? Hearing none, the minutes are approved. Public comment? Everyone here seems to be part of Human Services, so there's no public comment. Okay, then we'll go on to the unit manager program.
Let's just start in the same order that we always do, so.
Good morning, I'm Sue Norton, the Behavioral Health Manager with Human Services. To start off, does anyone have any questions regarding the stats that were provided for the month? I think they're pretty much consistent with what they've been. Okay, with no questions, then what I'd like to do today is talk a little bit about crisis and how we go about budgeting for crisis. Since there's, understandably, there's a large focus on finances, and I just want to kind of give you a snapshot of how we try to take a look and then what the reality of the real world is when it comes to crisis. So the crisis program is a county mandated program, meaning that we don't have a choice as to whether or not we provide this service. It's not something that we can just say, well, that costs too much, we're not going to do that, we'll let someone else pick up the tab. And crisis services are for anybody that is in the county. It is not for anyone that is just a resident of the county. So if I have someone from Santa Fe, New Mexico, come into Kewaunee County, they come into crisis, they are now our responsibility because the crisis is occurring in our county. No different than if one of our county residents goes to Brown County grocery shopping and they go into crisis, Brown County then would have that responsibility up until some point to manage that crisis. So so crisis really, when people go into crisis, it's that they're unable to manage, due to whatever their mental health condition is, they're unable to manage what is going on in their life or what they are experiencing. Oftentimes what we're looking at is assessing for imminent risk to harm, for harm to self or harm to others. So in essence, we're assessing to ensure people, if they're suicidal, that they're not going to kill themselves, or that they're not going to kill someone else if they're homicidal, or that they have the ability to manage, or that we're able to plan with them to manage to the point where it wouldn't result to them escalating into a more significant situation. So we have, based on state statute, we're required to do what's called the less restrictive measure of treatment. So we can safety plan, meaning if someone's in crisis, and they could be suicidal, they could be homicidal, but if we're able to come up with a plan to help keep them safe, and this usually results in us having to rely on other people in the community, family members, friends, natural supports, that they're willing to come into an agreement with us to say, yes, I'm going to provide them with the level of supervision they need. Yes, I'm going to secure any forms of means of access to them hurting themselves or someone else. And yes, I'm going to commit to this until they're stable. If we're unable to find that, then we have no choice but to, if they're at imminent risk, we have to have them go to the hospital. So we have safety planning, which is the least restrictive, voluntary admission, where if someone has to go to the hospital, we have to see if they're willing to go voluntary. The risk of going voluntary is they can get to the hospital and they can leave at any time. Then it's up to the facility to then say, well, you're still suicidal, you can't leave. Now this becomes if they're in Brown County, now this becomes a Brown County crisis, because if they choose to leave, they're in Brown County and they're in crisis. The most restrictive measure is called an emergency detention. And what that means is, and the only people that are able to say yes, an emergency detention is warranted are myself and my crisis staff. So Scott, as our director, can't make a decision. No one back here can make those decisions. And then we collaborate with law enforcement on it. Law enforcement can't make that decision independently anymore. That changed a couple of years back, where now it's crisis staff have to make that decision. So when it comes to budgeting for crisis, what we do or what we have done is we've taken the data from the last 2 years. We've looked at how many calls that we've gotten, how many hospitalizations have we gotten, how much money we've actually had to pay out for those hospitalizations. I would say, and Brian, please correct me if I'm wrong on any of this financial stuff, I would say the most unpredictable expense are psychiatric hospitalizations. So whether or not we stay within our budget is really going to be determined on, or it will likely depend on the number of people that are hospitalized as well as their length of stay. So as a crisis worker, if John Doe goes into crisis and I determine that he needs to be hospitalized, I go through the whole process and get him into the hospital. Once he's in the hospital, then it's determined by the hospital or the psychiatrist how long they're going to stay. So at minimum, usually for an emergency detention, it is 3 days at the cost of anywhere from $1,200 to $1,800 per day. So once they get there, that psychiatrist has to determine, are they stable enough to be left out of the hospital? What we find is sometimes they're discharged when they're not stable, and then we do the process all over again 2 days later or a week later because they weren't there long enough, because the hospitals are inundated with people from throughout the state, and some, like Winnebago, gets out of state individuals as well. So that unpredictable, I could say, yeah, we're going to have 20 EM1s this year, and I can say, yep, three of them will be at the average of 3 days a week, but that's likely not going to be a wise budget decision. I know from past experience, we have at least 2 individuals per year that end up extended stay, meaning over 30 days in a facility, because that's how long it takes to stabilize them. I know that because I know the individuals, and there oftentimes can be some of the same people. However, not always the case. So in 2019, for the entire year, we had 29 emergency detentions. So meaning we had to have 29 people go to the hospital against their will to stay there a minimum of 3 days. And then they go to court, and court determines whether or not they have to stay longer, and then they determine, there's a whole lot of other things that go on behind the scenes. In 2020, through the month of October, we've had 41 emergency detentions. 29 for the entire last year, 41 for this year. Now, if you're all about dollars and cents, you might say, Sue, you guys aren't doing a very good job. Why aren't you diverting all those people out of crisis? And it's really not that easy. So it's a 38% increase in EM1 since last year. So I'm going to use the opposite. If you were having a heart attack, if someone's having a heart attack, it's likely because some organ in their body, probably their heart, is sick. If someone is going into crisis and they need to have a psychiatric hospitalization because they want to kill themselves or someone else, their brain is sick. To me, apples and oranges. Your brain, to me, is just as important as your heart. However, on the flip side, if you were having a heart attack and rescue comes, and you know you're having a heart attack, would you want them to say, well, we're going to put a pillow behind your head and prop your legs up and hope that holds you for a while? Or would you want to go to the hospital and get treatment? My guess is you're going to want to go to the hospital and get treatment because that's what you know you need, or you're going to die. The same holds true for those who are suicidal and want to kill themselves. It's not a decision that's made lightly. The difference also being is if you have a heart attack, you go to the hospital, your insurance is likely going to cover it, or a large portion of it. Not so true with someone who goes to the psychiatric hospital, because we don't have mental health parity in the state where it's equal coverage for your mental health in comparison to your physical health. So in the last 6 months, I would say the length of stays have significantly increased. Usually I can predict we have 1 to 2, likely 2 extended stays of someone per year. When I mean extended stays, I'm talking 30 days or more. We are currently on our 5th this year, and it's the beginning to mid-November. And those are 1 month or longer. And the current one will be there for up to 90 days at roughly $1,200 a day. Now, we do get some kickback from insurance. Some insurances will pay for some, but because we're responsible to pay the cost of the remaining, and then we bill the clients for what the unmet costs are. So if someone doesn't have insurance, we're paying the entire cost 100%, and then trying to get some compensation from the clients, which isn't always, we're not working with the most wealthiest population of individuals, and that's a difficult process, and that's a process for another day. So just to give an example, in 2020, we budgeted for Winnebago Mental Health Institute $63,000 that we would have to pay out in costs for this year. Through September, we've spent 27, or we've paid them 27 of that $63,000. However, that doesn't include the $123,500 of pending charges yet that we're still waiting for insurance to cover part of that, hopefully cover part of that, and then we're going to have to pay our portion of that. And like I mentioned, I currently have someone there who's going to be there for 30 to 90 days, which is going to be at the cost of, about $90,000, maybe less 60% of that, because their insurance should pay 60% of that. So another, I don't know, my math is horrible. So we're going to be over our 63,000. Is it going to be destitute over 63,000? No. Could we have predicted when we were doing 2020 budget that COVID-19 was going to happen? Probably would have been nice if we could, but I think we're truly seeing some of the impact of COVID-19. I can tell you and I've been saying this all along, the severity of our calls and the severity of the situations that individuals are experiencing is heart-wrenching. We're not making these decisions lightly. It's life or death decisions. The risk of doing crisis is you underdo something, they could die. You overdo something, you put someone in the hospital unnecessarily, they may never call crisis again, they could die. It's finding a balance between state statute and what's in the best interest of these individuals. Big picture-wise, this also doesn't just affect human services. Looking outside of the human services bubble, every time we do an emergency detention, that has an impact on sheriff department budget or local law enforcement budget. Because being that we're taking someone into custody, for that matter, against their will, that means they need secure transport. Secure transport means law enforcement is taking them to the hospital. And it's not just a quick drive to the psychiatric hospital. It's a quick drive to the emergency room, and they can be sitting there for anywhere from 2 hours to 14 hours waiting for someone to get medically cleared before they can be admitted into the psychiatric hospital. So oftentimes this results in them having to call in extra staff. That could be overtime. They might predict it's going to be maybe 8 hours, but the one that stands out in my mind was there was an incident. I think the call started at 12:30 in the afternoon, and the woman was finally admitted at 12:45 a.m. It's like, and I think of, this is more than just dollars and cents. This is about this woman who is in great distress, having to sit there and go through this process for how many hours before she was even able to get where she needed to get help. It's not like you have a heart attack and you just go to the hospital. You have to go through all these hoops to be able to first get to the hospital to try to get some help and some relief. So it's not always an easy thing to predict. We do our best based on past history. All it takes to break that budget is 1 or 2 extra individuals who have an extended stay, and our prediction is just kind of out the window. question.
Sue, I do have just a couple. How many of these people are already on our caseload? I know you said if somebody would just happen to come into the county, those situations happen. How many of these are our clients that our psychiatrist is already seeing?
That our psychiatrist is seeing or that they're clients, because that could be two different things.
Let's talk about psychiatrist.
Okay. Our psychiatrist was seeing one of the 4 or 5 that have been in the extended stays. No, I take that back, 2.
How many of these people, this is happening multiple times?
Mm-hmm.
Is this the same 4 people that this is constantly happening to that are doing this and ending up in the hospital?
Not this year.
Okay.
Yes. There are, and that's where I can use my experience with past experience and knowing, we have some individuals in our community who are very mentally ill. I can predict that, it'd be a safe prediction saying that they're going to have at least one extended stay. Hopefully not more than that. Hopefully we can do. This year we've had more that were not connected in any way, shape, or form. I can tell you, and I don't have an exact number, and I apologize, the majority of our emergency detentions are people we do not work with.
Thank
People
you.
who we have no clue who they are. So we get our calls from law enforcement, we get our calls from school, we get our calls from just people in the community, we get our calls from, I've gotten calls from people out of state. And of the 2020 emergency detentions, 30 of them were adults and 11 of them were adolescents. And I can assure you that by no way, shape, or form are we wanting to put people in the hospital unnecessarily, because it causes a lot of additional trauma. And we have people who have gone into the hospital and they'll likely never call crisis again. If they're going to kill themselves, they're going to kill themselves because it caused so much trauma. So it's this, it's something we don't take lightly. And we're usually not making the decision ourselves. When it comes down to it, law enforcement's there, and we always collaborate with one another because those are big decisions. It's life or death decisions. Yes.
Early on, you said it was a county mandated program. Is it true, or is it a state mandated program?
I'm just aware of county mandated. I don't know if it's state mandated. County mandated, I think the state requires us to provide the service.
Yeah, when they say county mandated, it's the state is requiring the county to perform the service.
Okay.
So all 72 counties are required to have a crisis program. Who they do that with is up to them.
And then we are required to serve every client that has the need, so there's no wait list or anything.
Correct.
Okay.
Correct. Yep.
How did the budget for this 2021 compare to 2020 then? What was put in there, and how did you guys figure that out?
Did we go 2 or 3 years back?
Mm-hmm.
The last 3
So it
years.
didn't see a significant bump? You guys used pretty much what historic?
I think it came in roughly around 65,000, similar to where we were at.
So mind you, when we did some of the budget stuff, that was pre some of these people
Okay.
being in there. Some people that I wouldn't have anticipated being in there.
Plus, we've just started I believe we're just now starting to use this methodology. So over time, as we start to get this, our averages will get better, and we'll have that kind of range that we believe people will go in. But here's the 3-year average. But then we'll also be looking and going, oh, here's some of our regular returning customers. So therefore, we may decide to go above the average. Why? Because we have some of those folks there that will therefore, we believe that we need to budget higher than what the average is.
So the other part of looking at things, when you look at programs like CCS and CSP, you might see more expenses in some of those areas. Some of those expenses in a program that is better funded, because I would say crisis is very poorly funded. We may have a lot more services if we're connected to that individual in there. So it'd be like, well, Sue, are you spending $10,000 a month on this person? Because I'm trying to keep them out of the hospital. A, because it's in their best interest, B, they don't want to be in the hospital, and C, it is financially advantageous for us to put services in through a Medicaid covered program versus having to pay hospitalization fees that are zero funded for an adult through Medicaid.
Just staying away from the dollars and cents, so success stories. I assume there's a fair amount of success stories with these people that they have come around and they have had a,
Absolutely.
Okay.
Absolutely. We have some youth that have been, who started out in crisis. We get them connected to our program. They're in college now. You know, it's like, it's pretty cool to see, or to have the privilege to be able to see how they've come. You know, and that's the goal too. If we get people through crisis, we may not be connected to them, but we want to connect with them because we find that we have better results when we are able to connect with them. In Kewaunee County, outside of human services, there's one other provider for mental health counseling in the entire county. It's sad. That limits access for lots of people because they're going to have to go to Green Bay. They're going to have to go out of county for those. There are wait lists. If you have Medicaid, there's a wait list for 8 months to a year to get to get in to see a counselor. If we can get them in and see them sooner than that, I mean, that can be, they're wanting the help. We want to get people when they want the help. Lots of success stories, Tim. Thanks
Good.
for bringing that up.
For the adults that go in for emergency detention, are there a fair amount of those cases where their detention then causes crisis in the family at home?
Oh,
Or are there more people that are living alone?
We often see, no, that's a good question. Are you going to tap into my brain here a little bit? We have had individuals who we've had where they have young kids in the home, where we'll work very diligently to try to keep them in the home if we can. And that's really where we have to use their natural supports if at all possible. Or we've had situations where we were able to find a place for the kids to go, so that way it doesn't throw them into crisis as much. I'm not sure if we've had many.
I can think of, Julie, maybe a couple of instances over the last few years where it's really been okay, this parent has to go to the hospital and they have nobody, or there's been going to be a formal child protection role. I think generally Sioux folks do a pretty decent job of making sure those loose ends, so to speak, are handled and appropriately so that there isn't any formal intervention, which is, again, I think a byproduct of the working together that we always talk about how important it is to have that, global focus on this is an individual in crisis, but they are a member of the community and the family, and oftentimes do have other people. But I can't think of a lot of times where we've had to say, okay, EM1, so now we have to do a placement.
No. Okay. Thank you.
Any other questions for Sue? Okay, then we'll move on. Melissa?
Good morning.
I was hoping to expand. Can you hear me okay? Struggle with these mics. I wanted to share a little bit of information about our transportation program today. So I'll just go through, like I have in the past, of the various aspects of the program. So why do we need transportation? We believe that elderly and disabled populations deserve safe and reliable transportation to medical appointments, to the grocery store, to work, and to other outings. We believe in improving transportation options for persons with disabilities, older adults, and individuals who have low incomes. We believe in increasing transportation access. Access to transportation in Kewaunee County is very limited. Who do we serve through the program? The transportation program serves Kewaunee County residents of any age if they have a disability, and also adults age 65 and older. A disability status through our program is defined as any individual who has a temporary or permanent physical, developmental, or mental health condition which limits his or her ability to use services as effectively as persons who are not affected by the condition. Transportation is also available to individuals who are not a part of the target population if there's room available. What are our transportation programs? Kewaunee County's transportation program offers several options for consumers. The driver escort program provides rides to medical, nutritional, work, and other appointments. The service provides transportation by utilizing volunteers who are recruited, interviewed, and screened by Human Services. The drivers use their own vehicles and are reimbursed mileage. Driver escorts will provide transportation within Kewaunee County and to the surrounding counties of Dorr, Manitowoc, and Brown. The transportation program also has 3 wheelchair accessible vans. Trained drivers drive the vans and operate the wheelchair lifts. In 2019, we were awarded funding through a competitive 5310 grant for purchase of another wheelchair accessible van. We will be receiving a side entry bariatric vehicle that has 6 ambulatory positions and 1 wheelchair position. The grant amount was $39,293 with a local match requirement of $9,823, which is supported through our Transportation Trust Fund. The driver escort grant van program provided 4,746 rides in 2019. The transportation program also runs the Algoma route. This program utilizes a paid driver who drives a van within the city limits of Algoma on Mondays, Wednesdays, and Fridays, typically from 10 till 2. Due to COVID, we have cut out the Monday route because it wasn't being utilized. We do hope to resume the Monday, Wednesday, Friday in the future. Ride requests are called into the Kewaunee County Human Services, and the requests are dispatched to the driver through this program. In 2019, the Algoma bus program provided 1,091 rides. The transportation program also supports East Shore Industries transportation program. ESI's route structure provides transportation to people with disabilities to and from their homes to the East Shore Industries Rehab Center in Algoma. This service is provided by their employed workers. How do we provide transportation? Kewaunee County's transportation program is run by several part-time staff members. Lynn Clark, who takes notes here, takes ride requests and completes required paperwork for the program. Jody Vandervest and myself assist with completing the assessments for the program. We go to the home of the individuals to review program guidelines and also to assess and communicate any identified needs to staff and drivers. Lori Bushy is really the heart of our program. She runs the driver escort program. She recruits drivers, arranges rides, and organizes driver trainings. I work with and assist staff to complete the fiscal reports and apply for grant funding. Our volunteers are hugely important for our program. I am often touched by the amount of time our drivers dedicate to the program. I hear their stories about how they benefit just as much from the program as the consumers because they gain lasting relationships with some of our most vulnerable community members. We're always looking for more volunteers. This is my little plug here. So you or anybody else who may be interested, please let us know. Especially with COVID now, we've had a lot of our volunteers being a little bit more reluctant to transport, and it's certainly understandable. We do have 2 paid drivers. The driver for the Algoma route, as I'd mentioned, is paid. And then we also have 1 driver who provides a 6-hour regular route from Kewaunee, Luxembourg, and New Franken on Tuesdays and Thursdays. The annual funding for the transportation program is received from grants. We apply for an 8521 grant annually. The 2021 allocation totals $79,889 with a local match required totaling in $15,978. Passengers are also requested to pay co-pays. Joanne, one of our committee members, is also a volunteer for our program. So I just wanted to I hate to put you on the spot, Joanne, but I just wanted to maybe open it up to you for any feedback that you have on the program or your experiences.
Oh, sure. I've been driving for 5.5 years, and it's always been a struggle for us to get drivers. And I am always promoting the program and talking to people about driving. And I've gotten 0 0 people, which is very unfortunate because I think we're a very giving community. And I don't know, I understand some people don't like driving, but it's the commitment, it's very flexible because when Lori, who is amazing, the coordinator who is working with the client and the volunteer, when she calls and says, can you drive this person next Thursday to Green Bay for a 10 o'clock appointment? If I say, oh, you know what, Lori, I'm not available, immediately she says, not a problem. Thank you, Joanne. That has always been her answer. She can be, having a really, maybe I'm the 5th driver she called or something, and she will never pressure you and say, oh, you know what, Joanne, I hope you are available for this. I really need you. Every single time she goes, not a problem, Joanne, thank you. So, sometimes it's a last minute thing. Like the other day she called me and she goes, can you drive tomorrow for like Wednesday? And I was like, Lori, if I would have known a week ahead of time, I could have planned for it, but I'm not going to be available. So, the driver can say no at any point in time. So, because you're a volunteer. So I don't understand why people just don't become a driver. And if you need to say no a lot of times, or if you say like, Lori knows she can't call me on Tuesday and every second Wednesday because I'm tutoring my grandchildren or whatever. But geez, if you know anybody who has just retired or something and you think they'd like to get out there and do a little bit of good, and right now the people we're working with, I think they're the they're the safest population because they're staying at home constantly. They're only getting their food in or going to the grocery store and then going to that doctor appointment. They're not seeing anybody from the clients I've been dealing with. And they're sitting in the back seat. We sanitize the car ahead of time after. They're wearing their masks. If I have to be more near them, I have on my gloves too. And so if there's anyone you think at all, and I've driven, sometimes in the past I've driven like too much, and right now I'm involved with a lot of stuff, so I'm like, sometimes I'm glad if Lori's not calling me because I do have to a number of times say I'm not available, but I've driven as much as 1,000 miles a month in the past.
Thanks for sharing your perspective, Joanne. And you're right, it's a struggle to get new volunteers, but once they start, they stick with it because, as I said, it is a rewarding experience. So the drivers that we do have been with our program for a long time, and we're very lucky to have their assistance.
Could I add something?
Of course.
And we have seen, when you want to talk about success stories, we have seen the drivers have profound impacts on some of our individuals that we worked with who are very isolated, very depressed, where they actually looked forward to the ride just because of the conversation they were having, and that it gave them hope. And it's like, so it's been cool just to see. It's like you're volunteering, but you are really truly making a difference because you're willing to say, I'm willing to give you my time. And I think they know that they're not getting paid for it, that they're volunteer drivers, that says a lot. And we've seen a profound impact on several of the individuals that we have in our other programs that have used it.
I just want to share a story about a man that I drove he passed away about 2 years ago. And when I was driving him, he was in his early 80s. I drove him for about 3 years, twice a week to the Journey Club. I had known this man since I was a child, but he didn't know me. He was at the point of his dementia, Alzheimer's, whatever, that each day when I'd pick him up, he always thought it was Monday. He never knew my name. So one day I saw his daughter in the grocery store, and I said, oh, geez, I love talking to your dad when we're going to the Journey Club and back. It's 25 minutes each way. And she goes, you talk to him? And I go, yeah, we have like great conversations. And every time we go through Scarborough, he's telling me how his brother owned the bar there. And, we're talking about all these things, and I ask him questions about farming and he knows the answers. And she said, oh, when I visit my mom and dad, I always only talk to my mom, but I'm going to start talking to my dad now too. And then there was one time I was driving him, and I think most of you know that I normally go to Guatemala for 2 months in the winter. And so, then I'm not driving him. So the one day I don't know if it was getting to be that time of year or whatever, but the one day he said to me, are you going to be going on your long trip again this winter like you always do? And I just thought, what part of the brain is that coming from? You know, it just was exciting to know that there's a lot up there yet. Sometimes there's just different ways of pulling it out. So I've learned a lot from these people who have different levels of things going on as they age.
Thank you. Are there any other questions or feedback? Okay. The blue and white sheet has my monthly statistics on it. Just a couple things from there. So starting with the Children's Long-Term Support, or CLTS, I touched on this last month, so we are seeing many changes come down from the state level with regard to the waitlist elimination. So it is official. We are tasked with the process of eliminating our waitlist, and we will be moving forward with putting as many of those children on as we can. Their services will be 100% supported by DHS. The board members did receive a letter from me in support of moving that contracted position to county, and that's just as a result of my concerns about if we lose a staff member, we will certainly look to potentially be in noncompliance with this new order due to capacity concerns. If you have any questions about that, I certainly encourage you to please reach out to me. Unfortunately, that was removed from the budget, which I was sorry to see, but I hope that we can move forward with that in the future. So please reach out to me if you have further questions on that. For the Birth to 3 program, our coordinator, Carol, who you saw, I believe that was last month, she's training to take some CLTS cases, mostly the dual CLTS and Birth to 3 cases, so that we can increase some revenue. The Birth to 3 case management reimbursement rate is about a quarter of what we see in CLTS. So it's certainly a financial benefit for us to have her serve those dual cases. For the Coordinated Services Team program, we have some unspent grant money that we want to try and use up by the end of the year. So the spending in that program has been reduced as a result of COVID. So generally that program is covering training costs for some of our consumers and their families, and then also staff members. So we're looking at hosting a virtual training for staff in December, which will be focused on interviewing child victims with disabilities. I've participated in that training in the past, and it was one of the best trainings I've ever had the experience of participating in. So I hope that all of our staff are able to expand their knowledge base through that program, through that training. Adult Protective Services, you can see our numbers are calm there for the time being. In summer, we had that drastic increase, and since then we've calmed, and the financial exploitation cases have we haven't seen those the last few months, which is obviously a good thing. It's given Jody, our APS staff person, time to work on some of the annual WATS reviews that are required for some of the consumers we serve who are in protective placement. And then I gave you the summary of the transportation program. Just know that the 8521 grant process is nearly complete. We had the public hearing in conjunction with our transportation coordinating meeting on the 10th of this week, and we're working to upload those required documents. Questions or comments? No? Okay. Thanks for your time.
Good morning. I will be the last speaker here. Oh, no, sorry, Brian. Brian will be after me. You have my report on your desk. I was mistaken about when the meeting was this month, so it you can see in our numbers that we are holding steady for our CPS reports generally at a higher rate certainly than we had since we started the pandemic. Our youth justice referrals doubled, and I suspect that will continue, if not increase. It's Sue kind of talked about the impact COVID has had and how I think right now we're starting to see an impact on the severity of things as well as just the pileup of a number of months and days where people are just not functioning the way they're used to functioning and not having access to the resources they're used to having access to because of quarantines or staffing issues of other programs. And I think that we're gonna, I hope we don't, but I think we're gonna see the trend continue, whether it's mental health, child protection, youth justice, where we're just gonna start to see more contacts with our services because of that cumulative effect of what's happening right now. Again, we're holding pretty steady at contacts. Foster homes, like I said, that'll go up and down just based on need, and of course we don't have a wait list. Generally for unit news, we had a period where we were down a couple of staff members due to COVID and some medical leaves, and I think we're back, knock on wood, to having everybody up and running. But again, the new normal for all of us is that can change at any minute, so we're hopeful that continues to be a full staff situation. Like I've said before, I think by the end of the year now, we're pretty much confirmed that we'll have 2 children moved off of our placement list in 2 permanent situations. We have an adoption scheduled, and we have a guardianship hopefully scheduled soon by the end of the year. I would kind of, jump into here again a little bit of what Sue talked about. When it comes to the parity in mental health, I kind of like the mental health versus medical health or medical care. I just like that term parity because I think we don't have it, and it helps people understand the fact that the things people are experiencing are, on the same level as medical need, but they don't always get that kind of respect or interest. We are looking at, Scott and I had a good conversation a couple of weeks ago about looking at opportunities with positions and whatnot to improve maybe the access that the people who come in through our CPS and youth justice doors, improve their access and improve the efficiency and change how quickly they might be able to add or to get access to services in their time of crisis. So that's hopefully some exciting things on the forefront as far as how do we develop a program and pay for something that would allow us to improve outcomes and address the mental health of, I would say 110% of the folks that come in through the CPS and youth justice doors, they have those needs. Again, jumping off of some things that Sue and Missy said, I am a firm believer that we have prevented the out-of-home placement through coordination of services, both through CCS and CLTS, of about 3 children this month. I think that maybe doesn't seem like a giant number, but when you consider we have about 3 kids in out-of-home placement right now, 3-4 kids in out-of-home placement right now, to double that in a matter of weeks would have been catastrophic, both budget-wise as well as, mental health and trauma-wise for the folks that were experiencing that. So, Supervisor Kinnard asked about success stories, and I think those are, without getting too far into the details, for those 3 children, when the call came in to CPS, we were able to literally hit the ground running as kind of a team that allowed for either the improvement, the addition, the reinitiation of services for kids, and it literally prevented out-of-home placements. It allowed me to do a level of protective planning that allowed children to stay in the home and had services meet them at the door, day 1 and day 2. And it will likely result in very short-term involvement with the Child Protective Unit, and then more long-term involvement with
the folks in CCS and CLTS who can provide those services that meet the need to address the foundation issue in that family. So I don't have a ton more to share. I just, as you know, Supervisor Kinnard asked for success stories, I thought that's 3 kids in 1 month that we can say, okay, yep, we maybe sometimes have a hard time justifying the expenses in these other programs, but not when you consider them in comparison to mental health hospitalization or child placement for both cost as well as trauma reasons. Questions for me? Alrighty, thanks guys.
Thank you.
Good morning.
Morning.
Good morning.
I'll go through the financial statements that are package that we put out here. Okay, starting at the top, let's start with the billing report. Again, the billing report is a report that summarizes what we billed out for insurances and MA or Medicaid. Historically, we get about 65 to 70% of what we bill out, and that accounts for about 33% of our total revenues for the year. In October, we billed out 140,000 so far. We ran this report a little earlier, our meetings a little earlier this year than in the past, so we still have more revenues coming in. That puts us at a year-to-date of 1.8 million. Last year in October, we billed out 220,000, and at the year-to-date, we had a little over 2 million. So we're running about 137 behind last year with being short billing. Year-to-date, that kind of puts us in a position to be at 2.2 million for billing, compared to 2.362 in 19. So we are running behind last year, but with COVID going on, it also affects our billing here, and we do have providers that we contract with that we bill for them too, their services. So it's not just our staff not working, other agencies that might not be doing as much work at the same time also has a effect back to us in that way. Any questions on the billing report?
Yeah, Brian, I have a question for you. I know in the past, there's been a history of the doctors and people not getting bills in on time so we can get funding. Are we better now? I mean, I'm looking at the numbers here.
No problem anymore. Not a problem anymore.
Okay,
No. We get them the day of.
okay.
So that's been all rectified, so. Going forward for state aid report, again, this is what we claim through state agencies and programs. Again, we get about 34%, or another third of our revenue comes through this revenue stream. And we have different ones. The CARS report through DHS. So far, we've claimed through September 1,078,000 and we've been offered 953. So we've claimed more than what's out there. So some of the programs we've exceeded the amount that they offer. So we'll continue to claim on them till the end of the year, even though we won't receive much revenue on them.
And Brian, explain why we do that.
We continue to do it so they can see what our expenses are. So, if we have 150,000 expenses in birth to 3 for the year, then they're only going to give us 48,000. They'll see a trend with all the other counties that they're not servicing or giving us enough to meet our match. So we continue to fund, and some of these funds do roll over into the BCA, which we've already maxed out. That's like, was it this year, 548,000 or something? So we've already received all that money. So right now we're looking at just the funds that are still out there that need to be worked on throughout the year.
Yeah, basically what we do is we want the state as well as anyone else to see what the real and true costs are for providing those services, regardless if we get any other additional funds. And if for some reason there are additional funds available, then we have the record already showing that we have those expenses and could therefore possibly capture some of those funds. Otherwise, if we only report what we're going to receive, that's not giving a true number to either the state or to anyone else as to what the costs are.
And we will continue to bill at a rate of about 85,000 per month. We have received a net amount of $570 or $570,000 from CARS or from DHS for the program this year, but that really should be 792. They withhold some money from us. So far, they've withheld 145 for CLTS and for reconciliation purposes, and we pay our Winnebago expenses that Sue was talking about earlier through CARS, and that so far they have withheld or taken 76,000, but they also do their refunds through here. So by the end of the year, it kind of balances out, or it comes down to what we put in the budget, hopefully. Moving on to Sparks, which is a DCF program, we have claimed 746,000. We've claimed or received 612,000 of the 885, so we're about 69.2% of what we can claim throughout the year, with more months coming up. And last year we were at 565, so we're ahead of pace of last year for what we're claiming. And the last one is income maintenance, which is through DHS or economic support. So far, we have claimed 227,000 of 137 that's available, and we've received all the state aid portion of it. The rest, we are getting 50%, which is the sum sufficient part that the federal government supplies for the other 50%. So we'll receive 100% of that, or we'll get 50% of what we claim for the rest of the year, basically. We do have a couple things coming up. We have a $4,500 supplemental IM funding that's new this year that we're going to be claiming in October, so that will be coming in. And in October, we received $25,000 for the 2019 enhanced funding from the federal government, which is basically that 50-50 split. The government does a look at it and says, no, it should be 61-39. And they adjust the funding and give everybody more money. So our share of it's going to be $25,000. Any questions on the state aid report?
Quick question, Brian. What did you say the state gives us? 135,000? Is that what you said?
For income maintenance or what?
Yes.
The state gives us half. Basically, it's looking at the contracts, going to be somewhere around 70,000.
Okay, so that's what we get from the state.
And yeah, and we've maxed that out already, but now everything, it's kind of there's a state one and a federal one for the same amounts.
Okay.
Once we hit the state, it ends, but the federal keeps going. So they will pay, so 50% of it falls into the federal portion, of which we would get 100% of that, so.
Does it change a lot every year, or is it pretty consistent?
It's very consistent. And same with these, depending on the enhanced revenue, there's a couple extra payments we get throughout the year. The enhanced revenue, and then there's an RMS one, which is for the random moment sampling. We do 100% cost or time, 100% time tracking on our the way we do it, which is acceptable. The government does an RMS thing they'd like better, where they actually send out emails to our workers and say, what are you doing at this time? And they have to reply within so many hours, and they take all these statistics and say, you should get more money because you should be reporting, if you reported this way, you would have got more, so. And that usually can be anywhere between 8,000 and 30,000, depending on what's out there.
Is that listed somewhere? Do you have what our state aid is? Is that on one of these sheets? I mean,
It's,
can it go on this sheet so we know what to expect every year? I mean, if it's pretty consistent, or is that too complicated to put a little
that's not,
side note?
I can add state aid to that for you.
Okay,
or
just so
the
we
state
know
portion.
what we're supposed to get.
Yes.
All right, thank you.
Okay. Contract status report again is what we've paid out on our contracts through the year by month. Looking at where we'll be for year to date, what our potential, our balances, and where we plan to be if we keep at the same pace. So far, we're running good, so we don't have to have any addendums produced. We have been doing a number of contracts, which will be a list after my section on contracts that need to be approved, and we do have a couple 2020 contract additional contracts added on there. Vendor payments. Any questions on vendor payments? I just want to say this month we had $235,000 worth of payments. Last month was low because Innovative Services did not get their invoice in on time, so we paid it in October. So we had two payments in October, roughly 60,000-ish per invoice. So our payments were a little bit higher this month than last month. And there should be credit card sheets attached in your sheet for the managers of what they get. Now looking at the financial summary report, being that we're into September, we are 3/4 of the way through the year, or 75%. So that's kind of our goal that we're looking at. When we compare to budget, I highlight the columns that I'm going to be going through, kind of, I'll try to take a quick shot through here for you, so I won't put you to sleep. But if you look at where we are as we go down through it, administrative, revenues were at 1.2. Year to date, or for the budget, we should be at 754,000. So we are over budget by 478,000, but we probably will not receive much more in revenue in this area for the rest of the year, other than some rents and that we do charge, and maybe some miscellaneous revenue. So that's not going to change as far as what our actual is. For expenses, we had 418,000 compared to 475,000. We're 57 under. Again, without the director's expenses in there, that pretty much is where that kind of helps out there. In economic support, we've had revenues of 215,000 versus 200, and where we should be at 242, so we're under budget by 27, mainly because childcare, we are not able to do as much work in that area to be able to bill out there because of COVID and the rules that are applied to childcare from DHS. Expenses, we've had 188,000 compared to being at 196, so we're under budget by about 9,000. We do have a new employee in that area, so we're kind of, you're out without one for about 3 months, so we've kind of we'll be back a steady amount to what we had budgeted for the rest of the year there. Children and families, we've had revenues of 221,000 compared to 156, so we're over budget by 56, or 65,000 for the year, but youth aids and safe and stable, we've received 100% financing in those areas, so we probably won't receive much more coming in those areas, so throughout the year, those kind of just balance out. And as far as expenses, we've had 623,000 compared to 743. We are about 121 under, and we're kind of low in kinship. And another thing in youth aids is we have not had any placements that we had budgeted for. Knock on wood, that stays that way. Looking at the behavioral health section in mental health, revenues of 85,000 compared to 78, so we're about 7,000 more than we were to budget. Expenses 377 to 421, which is under by about 44,000. AODA, we are running, our revenues are lower than what we expect by 27,000. Again, we've seen less AODA, less IDP activity this year, partially because of COVID, I would have to say. And the expenses are also about 5,000 less. CCS and CSP, year-to-date, our revenues are 1,012,000, and we should be at 1,100,000, so we're running about 98,000 behind there, and expenses are also a little bit over there where we should be. We're looking at 1,079,000 in expenses compared to 1,010,000, or we're about 69,000 over. Again, COVID has changed the way we've been able to do our work, but we're still trying to get everything, get our billing out faster than we have, so we're seeing more revenues in that case. But I think with caseload's also been a little bit down because of the COVID or the way we do it. And that, again, providers are part of the number for the revenue stream there. Family and communities, long-term support, which is CLTS, CCOP, and CST. Again, some of these programs we are not able to perform in at CST. Again, like Melissa was saying, we're behind because of COVID. We weren't able to do some of the training and things that we've done in the past. We are going to be doing things there, but that puts us with revenues of 499 compared to 646, so we're under by about 147 revenues. Again, there's a third party with CLTS that is always a couple months behind in revenues, so that's that will be all caught up by the end of the year. And our expenses are running at 786,000 compared to 837, so we are under budget for expenses by 51,000 there. Our DD section, birth to 3, we've maxed out, so our revenues are at 66,000. And we should be at 54, so we're over by 12, but like birth to 3 is just going to be insurance payments, which will be a few more thousand throughout the year. Expenses will run at have been running 144 compared to 165, so we're under budget by about 21,000 in that area. Looking at aging and transportation, year to date our revenues are 116,000 compared to 103, so we're over by 13,000, but again we have a transportation grant in there that we received at the beginning of the year, so right now we're receiving mostly just our transportation funds and in that area. Expenses at 123 compared to 136, so we're under by 12, so doing okay there. So all said and done, at the end of the report, if we were to, if the year ended at the end of September, we would have be about 803,000 positive, and with 75% being our match or our goal, our revenues are at 81.4, so we've exceeded the 75%, and expenses at 70.4, we are under. Again, we are looking at year end after everything comes through with somewhere around estimated 200, I'm gonna say it, probably $200,000 more in expenses every month for the next few months to the end of the year. Will probably bring us down. We'll be in the 100 to 200,000 depending on what plays out with Winnebago. Might have a play in that, but we're still in line to show a surplus of potentially between 1,000 and or 100,000 and 200,000 by the end of the year. Questions?
To make it, I'm sorry, I'm going to jump in if that's okay, Brian.
Go right ahead.
To kind of make it simple for folks, because there is a lot of numbers there. How I cheat is I first go to the back page, the last page, and you see total human service fund. And then what I look at is the revenues and expenditures and see how my revenues compare to my expenditures. So there, right there, it's, we're at 81% revenues over 70% expenses. So that's a positive thing. And then from there, I go down to the individual units and programs where I try to look. So what we have seen throughout this year is a large increase in revenues, which I'm going to attribute to staff really working hard on trying to increase their billable hours. We've also had some of the programs, CPS is a good example, where we've had fewer expenses than what we've had in the future. So if you're wanting to look at the monthly finance report, start with the last page, and then what I would do is I would always go to what is basically the totals for each of the programs and look at the revenues and expenditures, so that should give you a good example. And I'll give a really good example is, again, let's go back to the children and family standpoint. That's on your second page. If you look under that, and you'll see that from there, the revenues are 106% of what they were supposed to be and only 62% of expenditures. But if you even want to go to the dollar standpoint, currently, and this may sound counterintuitive, but currently for the children and families unit, we're $401,000 in the hole. But where we should be is $587,000 in the hole. So again, that's a positive on our end in that the expenses are not where they should be. So while, yes, we are not in the black at children and families, we will never be in the black in children and families. The work they do doesn't allow us to bill for their services. But the great thing is the services they've been able to provide has at a lower level of cost than what was previously budgeted. So that's a good thing. Am I making sense at all? Only because I know with some of when I first started to do this, I'd look at the numbers and go, okay, there's so many different numbers. Pardon my French. What the hell does it all mean? So instead, to do it, look at the back first, and then look at the units themselves. And then from there, if you're wanting to look at the programs. And again, look at the dollar amounts, look at the revenues and expenditures. And what has always been the saving grace, because again, human services is not a money-making department, nor should it be, is that from the administrative section, which is right there on page 1, we have a large increase in our total revenues of almost $500,000. So that's a good work from our staff in being able to do that. So I'm sorry to have jumped in, Brian.
No problem. Yes, sir.
So you're projecting if you're being optimistic, or maybe you're being conservative, you're saying,
Actually, I try to cut back. I try not to, I could be more, but, because I'm
Okay,
not including
so-
winter in here, I'm not
Yep.
including some other things that could.
but at the end of the year, let's say we close the year with the $150,000 or $200,000 left over, you know, we're under budget. Does that go to pay down? That'll be a direct?
Yes, any, I'll call it surplus, any surplus that happens from the Human Services Department goes directly into the Human Services Fund, because that's where all revenues would be designated. Just the same as if there were any deficits in the Human Services Department, that money would be taken from the Human Services Fund.
Okay, thank you.
Okay, thank you.
Thanks, Brian.
Any contracts to approve?
Yes, you should have, I believe it's the last page of your packet. It has a list of contracts under 2021 and 2020. These are contracts that we have on an annual basis, and I'm not sure what was done in the past, but the committee should be approving these contracts as a matter of course. So I would recommend that there be a motion to approve the contracts as listed on the sheet.
So moved.
Okay, Tim made motion. Is there a second to that motion? Joanne?
Second.
Any questions?
So,
Yes.
so what are we approving? We're not approving this, we're approving the spending if it is billed.
Correct.
We're not necessarily approving that they will bill all that, right?
Correct.
It's just opening a contract so that we have a PO that when we need those services, boom, we can get them immediately.
Exactly. And the reason why you see that is if you go back to one of Brian's previous sheets where it has all the list of the contracts that we do, and you have a number of them that have zeros. The reason why is because we didn't use any of their services so far in the year of 2020, but when the need arises, the last thing we want to be doing is haggling with the contracts. So we have these contracts for a certain dollar amount, kind of on retainer or whatever you want to call it, and therefore if we need to use those services, we can then do that because the contract is in force. So yes, this does not obligate us in any way to spend any or all of this money.
How do we choose these vendors?
I would leave that more to the unit managers. I'll take a stab, and then if I'm wrong, please jump in. This is from a historical standpoint of providers that have provided these services in the past, but at times providers come and go, and so there will be times that the programs will be aware of a new provider and have some conversations with them, and depending on how those negotiations or discussions go, then a contract may be put into effect. Is that a fair assessment?
Yes, for the CCS program, that's probably one of our biggest contractors for behavioral health programs. There's a credentialing process, so if a provider is interested in being the service, they have to be qualified to do it, and they have to jump through all the hoops of getting credentialed so that we meet, because we're the ones that are billing Medicaid, we're ultimately responsible to make sure that they have all their training, their background checks, all that stuff done. And so then we bring them on board them as a provider. So we're in a consortium for that program, meaning we have shared service providers with Shawano County and Door County. So as a consortium, we work to recruit those providers as well.
So I guess what I'm trying to compare this to private industry. A lot of times we'll have the same kind of contracts, but periodically we would go look and see, do we have all the available ones? Are we getting the best rates? Did we do anything
For
like
our
that?
rates for CCS, that's determined by our consortium and the
Okay.
fiscal staff. Yes. So
Okay.
that's based on, because the program is supposed to be 100% funded on their end based on actual costs. So annually we have, and we use Door County, their financial person to do it because they offer that up to us, that we'll have them then submit to us their actual costs for the year, and then to determine if their rates are still appropriate or not.
Okay.
And
For
so
psychiatric hospitals, it's whatever their rate is. Their rate, it's difficult to negotiate
Right,
some of
yeah, I
those.
know.
Yep.
Yeah.
And many times, as well as if we have more than one provider, depending if the rate is already set, then what it is about the quality of the provider. Because we have certain folks that I'll say it this way, we prefer not to contract with them because we don't believe that they would provide the same quality of service as another provider. And if we're getting the same reimbursement rate, then we would rather go with a provider that we believe provides higher quality.
Why do we have contracts being written for 2020? These are
I think
last-minute
those were
contracts?
probably oversights that we're trying to get on there, but I'm not, I'll be honest. Brian, do you have a better
I can tell
answer?
you one of
So-
them, the options treatment program, is because I need them in 2020, and we didn't have a contract with them earlier on, so I need their service now, and they're first willing to contract with us for their service. They're an agency that will provide AODA treatment to adults and adolescents in addition to mental health treatment. So for our CCS program, they're first willing to contract with us and kind of need them.
The other one is from my area, it is a new provider willing to serve our community.
Are both of those going to be in the 2021 as well, or is this meant to cover 2020 and 2021?
They should be, the options should be in the 2021 as well.
We probably have not put together that contract yet.
Oh, okay, so okay. One last question. Now, I think I've seen in the contracted services report, sometimes we're over what the contracted amount was.
On occasion, that may happen, yes.
So does that imply that we've then amended that contract with them to just continue to track their spending?
If we look, there are times that what has happened is we're projecting that we would go over, so then yes, we would want to do an amended contract. If we haven't got, but the short answer is yes, we would amend the contract.
So let me ask it in a different way then.
Sure.
When I see a overcharge in that contracted services report, and I don't know if we have one today, maybe there's an
We do.
example. Is that one that has already been amended? And what I'm driving at here is we're approving contracts with a limit to how much we would pay to each of these contractors, and yet we see periodically that those we go over on them. So I'm not sure exactly what our concurrence is giving, what are we concurring to here?
Nope, gotcha. And there's a couple different ways that would work from a contract standpoint. Certain times when we do a contract, we're contracting for a certain number of hours that the provider will provide. And what could happen is that through the course of the year, it is determined that we're going to need more hours. So therefore, an amendment to that contract will need to be done because we will need more hours from that provider. The only one that is I want to make sure I have it right here. The only one that we're estimating right now has to do with TCM, which is our software company. And there are times that they could just decide, well, not just decide, but there are times that they may have additional services that we need from them that we'll have to bill, or an increase that they did not make us aware of. And unfortunately for right now, TCM kind of has us over the barrel, and the general feeling from our folks here is that if we could find a better program than TCM, then we would switch in a moment. I'm not sure that fully answered your question, though.
Well, the gist of it is we're being asked to concur with these contracts, and we could look at a couple things, who they are.
Correct.
And how much we're committing, the maximum we'd spend.
Correct. Well, and I don't want to say the maximum that we'd spend, Supervisor Baker. What we're doing is we're contracting because what we're looking at is from an annual standpoint that we're looking at X number of hours that in the past we've had with this provider. And again, because we're talking about clients that have various needs from year to year to year and new clients, we may need additional hours from that provider that we didn't need in the past. So to do that, and let's say we're going to go over what was the previously contracted number of hours, yes, we would need to make an amendment to therefore budget for and have the contract for those additional hours. So it's not as simple as just saying that at the Nitschke Center, we're going to contract for 300 hours of service, and therefore, once we reach that 300 hours of service, none of our clients will ever go to the Nitschke Center again. It's just if we need to have more hours at the Nitschke Center, well, then we'll have to do an amendment to that contract to provide those additional hours.
But it won't come back before here for approval.
We would still eventually have to come back for approval for that, yes.
Oh, okay, because what I had not seen this year so far is any of those that appeared to be going over coming back for approval for an increase.
From my understanding, the only one that possibly will go over is the clinical data solutions. Is that correct, Brian?
We had one earlier, didn't we?
Well, I would think it would still stay, we can find that out, but I would think that that would be on the contract report.
Any other questions? Otherwise, we have a motion and a second. Any other questions? Okay, all in favor, say aye.
Aye.
Opposed? Hearing none, contract is approved. Okay, then we move on to your report.
I have a few things. I'll leave the monthly report for a moment. I'll want to touch on a couple things that a couple of our unit managers did allude to. Yes, there are some county board members here, but we do have public board members as well. The county board did approve the 2021 county budget on Tuesday. One item the only change that had to do, well, there were two changes that affected the Human Services Department. One of them had to do with the pay plan itself. All county employees will be receiving a 1.65 cost of living adjustment. Any employee that was within the pay plan, their steps were frozen. They did not move forward and receive any step increase from that. So that is one small item. The second one is there was an item within the community service. I've always thankfully, because there's too many families in this. Family and Community Services Unit, we had put in the budget that there was going to be one position that was a contracted position that would then become a county staff position. It was my intent that we have roughly about 5 staff members that are contracted employees, that we would try to transition them one a year to be county staff. My rationale is that these folks have been with us for a number of years. We tell them when to come to work. We tell them who their clients are. In all intents and purposes, they are county employees, and so therefore let's truly make them county employees, as well as the additional part of it is from a recruitment and retention standpoint. With the new rules coming down from the state regarding CLTS, there will be counties that will have to hire more staff. And so therefore, a contracted staff person may find another county to be quite enticing because the pay will be approximately the same, but they would be able to receive county benefits of that county. That was taken out of the budget. That person will stay as a contracted employee. So those two items regarding the budget. Was there any questions regarding that?
Scott, is it your intention to bring that back again for next year? I mean, you seem like you strongly believe in it, and I do support you on it. I think it was the right thing to do.
Thank you, Supervisor Kinnard. What people will learn from me is that if I believe something is right, I continue to put it in the budget. So, yes, I do believe this is right. Yes, I would be putting it in the budget next year. Two other items. There is a request from Manitowoc County from the ADRC to start to combine the ADRC boards and the Aging Commission Board. I don't know that if specifically that is something that this committee would have to approve, but that is something that does affect us at least indirectly, if not directly. So I wanted people to be aware of that. We're having that conversation. I know at times it's difficult to find members of multiple boards that are similar in nature. So Manitowoc County will be looking at that as well. One last item, and Ms. Norton had referred to it in her presentation. Yes, we do have someone that is going to be placed institutionally. That's probably going to be for 3 months. That cost of Winnebago comes out to roughly about $30,000 a month. Yes, we will be able to receive a certain portion back from Medicaid, but again, these are those types of items that come out of the blue that we try to budget for some of them, but we never know how many people that may be. And so we do believe that that will have an effect on the budget, but it being in the last part of the year, then it's not going to have as significant an impact as it could if we had multiples otherwise. But I just wanted people to be aware of that. I still believe, knock on wood, that we will still be able to absorb that financial cost and still stay within our budget for 2020. Any questions regarding that? Okay, last but not least, I wanted to just have a general discussion. And honesty is always the best policy. So while, yes, I am a data geek and I am more than willing to admit it, I also worry about for the committee. I have tasked all of our unit managers to start to be providing you monthly reports that have caseloads, that have contacts, and then Brian to give you basically what could, if we really wanted to, have a 5-hour dissertation as to the monthly finances of the county. But I believe that after, that within 10 minutes, people's eyes would start to glaze over and they'd be going, Scott, what the hell are you doing to me? So I guess I wanted to have a better conversation as to, I still want you to have the information, but I guess I want to get some feedback from you as to how much do we need to expand upon it, or should we just be providing you the information so that you have it, and then if you have questions, you can ask? So which reports do you want the unit managers to give a report on? Which do you not? Again, because you have the contract report. Do we need to talk about it? We have the state billing report. We have, the sparks and the cars and all those others. And so the last thing I want to be doing is taking up your precious time with stuff that you're going, yes, I can read this, Scott, and for the most part, this is all well and good, but you don't need to have, staff expound upon it. So I would like some feedback, please.
My personal opinion is I think you're doing a good job. It's nice to have the staff here. I know it takes time away from them. I don't know if they used to come in the past, but I think it's important that we see them and we're able to talk to them. I'm happy with the information you have here. I think it gives us a really good view of what's going on. I don't know if that's happened in the past, but I'm very content as a new board member feeling that I could answer a question to to a taxpayer if they start questioning me about human services. So I'm once again happy with what we have.
My preference, and I think this is great, the amount of data we're getting is very useful, and it does, and the reports, the descriptions of the programs really help me understand what the work is being done. I do find that, the variety of different ways it's presented, it would be nice if it was a little more similar and we could get, better titles, and some of the acronyms were spelled out, because I get confused month to month as to what each one is. So yeah, I think I want to see the data. I'd like to see it so we know maybe more in the graph form, so we can see if it's out of where we expect or in. And I think now we're getting to a point where the program managers are just saying, things are pretty much normal. Are there any questions? I think that makes sense. I'd still like to see the data though. And then with Brian's stuff, I think we had this discussion this morning. What is being done and what is being refunded versus what Brian expects to see would be helpful. And also this idea that the reimbursements are not, they don't track very well with the billing. The idea that we could have some idea of what past years have looked like. So Brian could point out to us, yes, this is tracking behind, but if you look historically on these charts, you'll see that that is expected and we will make up for that in November or something like that. Because one of the things I'm trying to do is just to make sure we don't miss something where we can ask the program managers, you're off track there. What can you do about that to bring that back on track? And to have the tools to do that, I think that's what we need there.
Now, there are some longer term, and thank you Supervisors Baker and Kinnard. We also, though, have some longer term committee members as well. I would like to get some, because don't get me wrong, if I'm new, of course I want as much information as I can. Why? Because this is all new to me, so the more information the better. But we do have some members that have been here for a little bit longer than a few months, and so I wouldn't mind getting some feedback from them as well.
Okay. I'll make a comment to that. I've been on the Human Service Board for quite a few terms now, and when I first got on, we saw no financial information whatsoever. We heard what programs they were doing and how many people they were serving, but the finances were never ever discussed. And that was part of the reason why we said, hey, we need somebody like Brian to come on board here and start doing this stuff, because we didn't feel we should be just leaving it up to finance to do the finance. We needed our committee to see it. So it's come a long, long way just since I've got on the board.
That's good progress.
Mm-hmm.
I think it's important to have the managers here to speak to the financial aspects of it, but also when they can comment on the human aspects of the cases. When Sue was talking about, how it impacts the people when they go for a detention, or how it impacts the family unit, or when Corinne was speaking about how they're going to be able to reduce the out-of-care caseload through adoptions or through guardianships. I think it's important for the committee to understand how that impacts the kids in terms of permanency for them. Mm-hmm. So I think both the financial and the human aspect is important.
So again, I'll challenge everyone. Are we giving you too much? Are we not? I won't say are we giving you too much data, but are we taking too long by going through the data to the level that we are?
Okay, I'd like to comment to that. I don't know if it's because I'm a CPA that I kind of feel like I can see these documents from Brian and read them and just ask the questions. I don't know that we necessarily need as long of a Brian report. I do like all the other detail reports, though, on the services provided. But the finances, if we got it in black and white in front of us, I'd like to just see the, basically bottom line, how are we doing?
Others? I see one shaking head. Others at all?
I'm okay with that also. I mean, I can see the forms and read them ahead of time, and if I have a question, I certainly will ask.
I don't believe we're getting a clear enough picture financially, but I think it could be done in the right format, that we could look at it beforehand and he could do a summary and we'd all say, I don't have any questions. I think that's the worry I have. I still don't have a picture of what is supposed to be where in terms of reimbursement. That's my concern.
And I'll echo your concerns, Supervisor Baker, in the respect that we've been trying to put stuff together to somehow put together a picture, and I'm not satisfied just yet with what it should be either. I think there is a way that we can do this in a format that is easy for those that enjoy numbers and those that don't enjoy numbers, that they should easily be able to understand what kind of the financial picture is. And I'll continue to work on that with Brian and the staff into 2021. I guess my whole fear just was that I continue to go with the way that I'm going, and we've spent half an hour or more on financial reports or reports otherwise, and the committee isn't finding it of value. your time is valuable. The last thing I want to be doing is having you have to sit through stuff that you're not finding to be of value. And so that's my only reason why I'm asking for input, is I want to make sure that, one, you're getting the information that you want, but two, that also it's of value. So.
One of the requests that we didn't touch on was the idea that the year does not, I mean, the year as shown in the data seems to start with just one entry in January, when in fact this is a continuum, and I would like to see 12 months worth of data so that we can really get a picture, especially with the caseloads and all that, rather than just start in January with one number and then we rely on the program manager to tell us whether that's normal or not.
Well, what we could start to do, Supervisor Baker, and I had been thinking about this, is maybe doing it from a historical perspective. So that way, yes, we're still starting in January, but you're seeing the year before as well. So that way, you're still getting kind of the extra 12 months, but it's easier then to compare January to January, because if we just do 12 months, we're missing what had happened the previous years, and depending, there may be a spike in November of something, but that always happens. Right. But we wouldn't know that without the historical of previous years.
Agreed.
So.
I agree with what Julie said about having I like having the managers here and getting the personal level of their work. And then with the financial, and I think Brian is offering his expertise in picking out the different parts of the report that, maybe we should focus on. I appreciate, his knowledge, and so, we don't have to sift through everything ourselves and try and understand every single line. He is alluding to the thing and pointing out things that are more important.
Fantastic. And yes, I'm sorry, I did not echo. Again, I did not know specifically how human services meetings were in the past, but yes, I believe it's absolutely essential for the unit managers to be here. Why? Because if there's questions regarding programs, they are the ones that are best going to be able to answer that question. In that same respect, there might be items that have a financial impact, and again, they're going to be best equipped to be able to help answer the reason why something may have went up. Well, if you have 2 institutional placements, that the unit manager is better going to be able to do that. Or if all of a sudden you had out-of-home placements and that, or you had an increase of 10 more clients in birth to 3 that we must serve, that's going to have a financial impact. But those unit managers are going to best be able to answer and address some of those issues. So.
I also appreciate the opportunity to be able to be here, because I think my mind just is going back to the contracts. And when, if you were to say, no, we're not going to do this contract, I can be here to say, yes, why we need this contract. Mm-hmm. I think I know why I need that contract in 2020. And if you were to say, no, Sue, we're not going, as a group, you'd say, no, we're not going to approve this contract, then my response is going to be, then who's going to do the work? Where I can defend that, where perhaps someone else may not be able to, because I know the reason why we have that contract.
Yes, I wouldn't be able to answer that question, only Sue would.
So I do appreciate the opportunity to be able to be here and have a voice for my programs.
Okay. I don't have anything else then, Madam Chair, as long as there's not other, and if there is other concerns or feedback from the committee, please do not hesitate to contact me. As I've said before, this is a work in progress, and I want to try to continue to refine this process so that way it's getting you the information for you to be informed and be able to make really good decisions. Thank you, Madam Chair.
Okay. Next item is to set the December 17th meeting at 8 o'clock.
If I may, Madam Chair, December 17th, there will be a training for some of our staff, so I'm not sure that the managers actually would be able to attend on the 17th. If it would please the committee, we could do two different, the two options would be, one, to decide upon a different date so that way the managers could be here, or two, I'm not sure that firmly tongue-in-cheek, I don't think I can screw up a December meeting that would therefore get us out, would kill us for the rest of the year. So if the committee does want to meet on the 17th, we could just do the meeting without unit managers. Whichever the committee pleases.
I'm okay with that. Can we would still get the reports though?
Correct.
So they just wouldn't be here to read them to us, okay.
Otherwise, what about December 10th?
I'm okay with that too, moving it up.
Whatever the
Would-
pleasure
would-
of the committee
Would people
is.
prefer to move it up to the 10th and have,
I'm okay with that.
okay. Okay, how many here would be able to make the 10th at 8 o'clock? Pretty much everybody, okay, then let's do the 10th and then go ahead and have it, okay.
I guess there was a great fear that you were going to screw things up without your unit.
I guess so. Well, don't get me wrong, if it weren't for the unit managers, yes, I probably would screw things up. So I thank God for them.
Okay, so that being said, now we can do a motion to adjourn?
So moved.
Second?
Okay, second, all in favor?
Aye.
Aye.
Aye. Okay, opposed? Hearing none, we